everybody. My name is Logan Bell, and I'm a CMD major. Today I'll be talking to you about one of my favorite topics, fluency disorders. Fluency is the aspect of speech production that refers to continuity, smoothness, rate, and effort. There are two types of fluency disorders, stuttering and cluttering. Stuttering is a communication disorder that is characterized by disruptions in the forward flow of speech. These disruptions are often called disfluencies. Now, there are three types of disfluencies. The first one is repetition, the second one is blocks, and the third one is prolongations. If you have stuttering with repetition, it would sound like this. Today is Tuesday. If you have problems with prolongation, it would sound like this. Today is Tuesday. And if you struggle with blocks, it'll sound like this. Today is Tuesday. Secondary characteristics. These are behaviors that happen due to stuttering. These behaviors can be uncomfortable for speakers because they can draw more attention to the stuttering itself. They usually include eye blinking, face grimacing, fist clenching, head jerks, tremors in the jaw or lips. Here's a video of a girl working on treatment for stuttering. About stuttering. Here are probable causes to stuttering. Abnormalities in speech motor control. Some evidence indicates that abnormalities such as timing, sensory, and motor coordination may be involved. Another thing that they believe causes stuttering is genetics. For an example, I have a cousin who stutters, and he has a son that also stutters. Stuttering can later take a toll on your life. It's common for children between the ages of 2 and 5 years old to go through periods when they may stutter. For most children, this is part of learning to speak, and it gets better on its own. However, stuttering that persists may require treatment to improve speech fluency. Complications you may face later on in life are problems communicating with others, being anxious about speaking, avoiding speaking because you're scared about stuttering, loss of social, school, or work participation and success. People will tease you over it, and it'll lower your self-esteem. That's why it's important to get speech therapy if you're past the ages 2 to 5 years old. And the second part, cluttering. Cluttering is a fluency disorder characterized by a rate that is perceived to be abnormally rapid, irregular, or both for the speaker. As you can see in this picture on the right, this man is portrayed as having the cluttered speech, and this is the person listening. As you can see, the speech that comes out of his mouth is all cluttered into one, and this person's looking like they don't really understand, as a result to the abnormally rapid, irregular, or both speech. So what does cluttering look like and sound like? Their speech comes out in rapid bursts, which is described as irregular rate, and may include pauses where it doesn't feel appropriate. Often people who clutter have what many speech pathologists refer to as machine gun speech. It all comes at you at once real fast and it's hard to understand. Some examples of disfluencies that are more typical of a person who clutters is excessive whole word repetitions, unfinished words and interjections such as and well. Co-articulation refers to when a person collapses or omits a syllable of a word. For an example, saying waffle for wonderful. You skipped a whole bunch of syllables in the middle of the word wonderful, so you can barely tell that it says wonderful when you're saying waffle. There's also a video right here that you can listen to an example of a child getting treatment that clutters his words. Here's just a little picture of the difference between stuttering and cluttering. Here on the left, this man, it's easy, regardless of him stuttering, it's still easy for you to read. When you read this, it says the, which will be a prolongation, quick brown, which will be a repetition, fox, jumped over the fence. So regardless of him being a stutterer, you could still read what he was saying. When you come over here on the right to the clutterer, all his words are jumbled together and you don't really know what he said. And this is just my discussion forum. My topic was fluency and communication disorders. My audience was towards students, speech therapists, and patients and parents. Thank you for watching.